All right. Well, welcome everyone to our fifth edition of our Kansas Mental Health Coalition Mental Health Parity Series. With us today, we have Amy Campbell with the Kansas Mental Health Coalition and Kim Richter, who's a parent who will be talking about her experience and the experience of her loved one. Amy, do you want to go ahead and introduce yourself real quick?
Yes, my name is Amy Campbell. I am the lobbyist and coordinator for the Kansas Mental Health Coalition.
And my name is Audrey Dunkel, and I'm the chair of the Mental Health Coalition Parity Committee. And Kim, if you would like to introduce yourself.
Sure, I'm Kim Richter. I happen to work at KUMed, but today I'll be speaking on sort of behalf of my family and our experiences with getting coverage for some treatment.
All right, before we let Kim get started, just a couple housekeeping things. Down at the bottom of your screen, you should have a little icon with two bubbles on it marked Q&A. If you have questions as we go through the program, if you would put those in that Q&A, that way Amy and I can help make sure that Kim can get all of those answered. Any clarifying questions we'll answer during her presentation, and then anything else will hold until the end of her presentation. All right, Kim, take it away.
Great. I will. So I am going to share my screen. And here we go. And please, folks, pipe up if you're having problems seeing or hearing, and we'll try to fix that. And all right, so I mentioned before, I work at the University of Kansas Medical Center, but this talk is not, I do not speak for the medical center, and this is really just about my experience, our family's experience with getting substance use treatment paid for. And I have no financial disclosures. Okay, so I don't know how many of you guys remember this movie. Some people loved it, some people hated it. But what it was an exploration of what happened to people in the American medical system who had insurance coverage and who got very sick. And, it was a story of bankruptcy and, lots and lots of difficulties. And I'm going to share a similar story today about my family, who was fully insured at the time that my son went in for his second round of substance use treatment, and our sort of efforts to try to get that covered. Now, I want to point out that most people in the United States with mental illness or substance use disorders have some kind of coverage or insurance. 1 out of 5 are covered by Medicaid. Over half have some form of private insurance. 7% have some other kind of coverage, and 15% have absolutely no form of health insurance coverage. And because people have insurance coverage, you would assume that they would be able to get good care for mental illness or substance use disorders, but that really hasn't been the case. And so there have been a number of federal laws to try to close that gap. In 2008, the Mental Health Parity and Addiction Equity Act, passed a provision that private insurers or insurers had to ensure that if they covered behavioral health services, they were no more restrictive than coverage of physical health services. They could decide not to cover some mental health diagnoses, but if they did, then they could not be more, then that coverage couldn't be more restrictive than the kind of care, the kind of coverage they provide for physical health. In 2010, the Affordable Care Act did a lot of things, but one of those things was that it required a lot of private insurance to cover substance use disorder treatment as one of 10 essential health benefits. And then the Consolidated Appropriations Act in 2021 placed new parity reporting requirements on insurers. So all of these things were, efforts to make sure that parity existed in truth and not just on paper. But unfortunately, people, and I'm going to be focusing on treatment for substance use disorders at this point, from this point onwards. It's been estimated that people with medical or physical health needs, about almost 90% of people get some kind of care for that treatment, one way or another. Now, for people with mental illnesses, only less than 50% are estimated to get some kind of care for their illness. Now, when you break it out to substance use treatment or substance use disorders, only about 1 out of 10 people get some kind of care for their illnesses. So I want to describe my family's experience with my son's latest round of treatment. He's been through 2 major rounds of treatment. His name is Nick, and he has given me permission to give this talk and also use his name because we really want to get the word out on how difficult this has been and hopefully try to make a difference. Now, in February 16th of 2021, he was admitted to inpatient treatment, and both our family and the provider called his insurance company to make sure that everything was square and that he would get, should be eligible for coverage for his care. And we were told that there was absolutely no pre-authorization even required for his care. Now, when he was admitted to treatment, and he got his treatment through Caron Renaissance in Florida, and Caron, Pennsylvania is a very old, really outstanding treatment program. And in 2010, Nicholas did intensive treatment with in Caron, PA. And we were referred there by folks out of Harvard, actually. We've been struggling with care for him for a long time, and they recommended a couple of different facilities, and we went with Caron, PA, because they had a young adult male program. And he went on to do great things after his treatment and was in recovery for quite a while and abstinent for quite a while. So we wanted to go with the same model, and so that's why we decided to go out of network to Caron Renaissance in Florida. And when he was admitted there, he was diagnosed with alcohol use disorder, other stimulant abuse with stimulant-induced psychotic disorder, and also adjustment disorder with depressed mood. And as required by many kind of well-known facilities that provide care kind of nationally, they required payment in advance. And then they submitted claims to the insurance company for reimbursement to us. And I can talk about how we paid for that later. The cost that was billed to insurance and that we had to pay up front was $100,000. And Caron did not submit claims for housing to the insurance company, and that was $27,000, which we knew we wouldn't see again. Okay, now we didn't know this at the time, but Caron had been submitting on a monthly basis as treatment was completed, medical records and claims to a host plan in Florida that communicated with Nikki's insurance plan in Kansas City. And all of those claims were sort of sequentially denied. So then at the end of his care, when we looked into, whether we could claim for his care, they had already been denied. And it was kind of a strange process where his plan in Kansas City had a host plan that would receive documentation and claims in Florida, and then in Florida they would review those claims and then reject them or pay them. And they just rejected every single one of them. So then when we looked into why these things were denied, okay, well, number one, the reason that was provided was that the service was not documented in the medical record. So on our first appeal, then we had to go to the Kansas City, this was Blue Cross Blue Shield of Kansas City. We had to go to the company and ask, them for an appeal. And they wouldn't get the medical records from their host plan. We had to get our son to go and sign a release of medical records, and then Caron had to send the medical records up to Blue Cross Blue Shield of Kansas City, which is a little perverse, it seems to me. Why couldn't they transfer them internally? But they did not. So we had to do that runaround. So Then we had the medical records sent up to Blue Cross Blue Shield of Kansas City. They sent them out to an independent medical evaluation specialist for review. And that specialist recommended denial for 3 reasons. They said that the medical records lacked sufficient documentation that Nick was under the direct care of a physician, that clinical documentations for patients admitted to a partial hospital plan had to be under the care of a physician who certified and recertified the need, reflect a minimum of 20 hours per week of services, and prove that the treatment goals were being incorporated into the services provided. So, Blue Cross Blue Shield took this under advisement, and they said that this meant that the treatment that Nick got was not in compliance with ASAM or CMS guidelines. And so then they denied again after the first appeal. So I had gotten a copy of Nick's record, and absolutely every one of these things were included in the medical record documentation. I had to read through them, and I have props today because I'm presenting from home. This is almost 500 pages of medical records that we got and then had to get scanned, et cetera, to submit to Blue Cross Blue Shield, et cetera. And it's all in there. So we had a second appeal. And so we completed that appeal to Blue Cross Blue Shield. And then we also sent in a complaint to the Kansas Insurance Commissioner's office. And we secured a lawyer. And we sent a demand letter to Blue Cross Blue Shield saying, please pay. And then the complaint to Kansas Insurance Commissioner. And the Insurance Commission's office got right on it and sent everything out for external review. And they told us that we as a family should send everything into them, that if we didn't send stuff independently into them, all the medical records, et cetera, that they would have to rely on what Blue Cross Blue Shield would send in. And so we did all of that. And then they sent it out to another external review. And then afterwards, they communicated with Blue Cross Blue Shield via back channels. And lo and behold, our claim or the claims were then approved. And the reason cited was that the company, Blue Cross Blue Shield, determined that benefits were available under the policy. So hooray, hooray. Sounds good, but we ended up getting kind of pennies on the dollar because the claims that Karen ended up submitting to Blue Cross Blue Shield actually amounted to $98,000. There was one day that was missing that they ended up sending in later, and we did end up getting some reimbursement for that. But this is what the math was kind of based on. And now there was an allowable for out-of-network providers that was only about 32% of what was charged by Karen. So right there, the reimbursement was cut into 1/3 of what it cost us. And then there was a co-insurance that we had to pay as a family of $8,000. And then there was a deductible on top of that for $4,000. Now, the total that was reimbursed was $19,000, which doesn't add up if you do the subtraction up above, but we weren't going to complain about that. It was a little more than we expected. But then we subtracted, if you subtract out the lawyer's fees, then we ended up recouping $15,578 on the $100,000 or so that we laid out. So, how did this happen? There are very low reimbursement rates for any form of mental health care, including substance use treatment. Often there are pre-authorization requirements. We found that wasn't the case in our situation. There are very limited provider networks. I'm sort of blowing it up to, what people across the country are finding are the issues in getting reimbursed. So there are very limited provider networks. Now we knew we were going out of network. We went to Florida for his care. But even if somebody's trying to get care within a state or within, you know, the geographic region, very often they're not able to find somebody who's in the network. Now, there are very high denial rates, and we got pretty summary denials and a number of steps along the way, and people just give up after a while. And it was really only because I wanted to pursue this because my son really didn't have the wherewithal. He was doing well in his recovery. He was, you know, after he had left the intensive inpatient care, then he went to halfway house and was paying his own way, and he got a job and et cetera. But he didn't have the wherewithal to do all this follow-up. I had to do it. And most families don't have that ability. There are very long processing times. I mean, you know, you can, you know, just give up because you don't hear back forever. And I had to make many, many calls to figure out the situation, even of just getting the records to Kansas City. It's also hard to figure out what plans parity laws apply to. Like, I had the conviction that you know, that Nick should get coverage for this care. But a lot of people don't know that, in fact, their health insurance plan should be paying for mental health care, substance use treatment care. So it's very murky. It's hard to know when to keep pushing. And there's very little enforcement. And enforcement, you know, requires documenting a necessity and assessing compliance. And, you know, many states decline to participate in enforcement. And, you know, I think Kansas Insurance Commission's office really stepped up for us. You know, they did sort of what they could, but, you know, due to the high out of network or the low out of network reimbursement and other things, you know, we just didn't end up getting much reimbursement. So what can be done about this? And this is just what I've gleaned from there. I have some references down below in this slide. And, you know, other people probably have other ideas. So, you know, Congress can pass laws expanding parity requirements and enforcement. And we saw just recently that there was, you know, a new law requiring more documentation. Federal agencies can make rules to strengthen enforcement and reimbursement, especially for evidence-based practices. And states can step in and strengthen parity requirements. And health providers can report violations. And families can report violations or can start asking for help so that people see that this is a big issue. But, you know, again, you have to sort of get enough information together to be able to make a case for yourself. And I think that's very hard for families. And also for providers who are requiring payment up front, there's not a whole lot of incentive for them to go to bat for families. They've got their money. States can adopt standards of care for medical necessity. There was a big case, Witt versus United Behavioral Health, that has gotten a lot of traction. So I know the Parity Committee is looking at that. And advocates can provide information to people about what kind of coverage they should have, their rights, and guide families through the reimbursement process. You know, I did this on my own, but most people wouldn't be able to do that, I don't think. And organizations can provide technical assistance to facilities regarding how to code and document care. And I see this a lot in medical care, where, you know, there's a lot of pro companies that provide, you know, guidance on how to document in order to, you know, make sure you get reimbursed for the care you provide. And then legal aid even could provide assistance to people. So that's it for my talk, and I can stop sharing now. And, you know, we can open it up.
All right, thank you so much, Kim. Well, one of the things that has come in kind of in our question and answer is not really a question, but just a statement that one of the indicators for potential parity violation is a lack of an adequate provider network. Did you feel like that was part of the issue? Because you talked about wanting to access really quality care, and so your son went out of state. But did you also find there's no network or limited?
Right. So the 10 years before, when he first went into intensive treatment, we tried a lot of different providers. And he, at that point, had very, very heavy marijuana, cannabis use disorder, and also a lot of alcohol issues. And at that point, we kind of found it hard to find anybody who would take his marijuana use disorder seriously. And I was connected with treatment providers in other places who kind of coached me through a lot of different things, including getting creatinine adjusted THC levels with him at Lawrence Memorial Hospital. So because marijuana lasts in your system so long, it's hard to catch people being good, right? When they're being abstinent. And we had his car keys and everything. And so we were actually trying to provide this level of treatment ourselves as a family, which is difficult. So eventually, we went to a couple different providers, and we just felt like we couldn't get the care that he needed. So that's when we went out of state to Karen the first time. So we didn't try a second time to try to find an in-network provider. And we just thought, well, we'll just take whatever the out-of-network will pay. And we weren't that familiar with his insurance coverage at that time. He had bought the best that he could, he thought, which was, Blue Cross Blue Shield, Kansas City, and their higher level plan. So I agree. It would be really good to get a handle on, what's a clear indicator that the network is being restricted. And I would love to hear people's thoughts on that. So sorry, it was a very roundabout answer. We didn't even try to establish that the network was insufficient the second time around. He had such good results the first time.
The Kansas Mental Health Coalition's Parity Committee has done several provider surveys, and we've asked what they see on the ground in attempting to provide care. And one of the troubling bits of data that we run across is that residential addictions treatment seems to almost receive a blanket denial the first time around. It just appears from the numbers and from provider stories that most families are going to experience denials when a family member first tries to access treatment in a residential facility. My second point about this is, I think that when people are deemed to need residential treatment, you've reached a pretty dire situation for that individual's health. And so do you have thoughts about what that is to a family to experience this when a family member is finally ready to access assistance?
Yes. So in the first time around in 2010, we have been trying to deal with his marijuana use for years. He wasn't getting any money from the family. We had taken away his car, etc. And I was getting advice from my national network. And I collaborated with folks at the Adolescent Substance Abuse Program at Boston Children's, which is affiliated with Harvard. And finally they said, Kim, look, just bring him in. They evaluated him, and they said, and they saw kids with a lot of pretty heavy duty stuff. They said he had the highest THC levels they'd ever seen. And they recommended intensive inpatient treatment. And they gave me a list of 4 different programs that they recommended. And, he was really incapacitated at that point. And, it was when I finally was able to get him into treatment, it was such a burden off my shoulders. But I really had, the kind of support we were getting locally was like, well, you should kick your kid out of the house. It's time for some tough love. And, you always get that, you always have, kicking somebody out, but hey, that's a last resort. That's not what we start with. So it's, I think there's more awareness around what marijuana, cannabis use disorder can do to somebody. And then the second time around, he had been using everything, and it was, in fact, he was using heroin at one point, and I went and got a rescue kit for him, and no parent should have to do that. But I thought, well, what should a parent, I was trying to get him in treatment and stuff, but what should a responsible parent do? And I thought, well, at least, hopefully help him save his life, or his girlfriend save his life, or help him save somebody else's life until we can get him into treatment. So I'm sorry, I ran on and now I can't remember what the question was.
No, I think you addressed that. I think that we often see that for individuals, and a lot of times these are young people that are struggling with mental health disorders or with addiction treatment issues, or both. And the attempts at outpatient treatment or
Oh, yeah.
different ways of dealing with that may or may not rise to the level of documentation that insurers want to see, because those attempts are they're not as structured as repeated appointments with a primary care physician would be, as far as the medical record is concerned. And so what I was trying to say is that we're just seeing a troubling incidence of parents who are they're so relieved that their loved one is finally ready to seek assistance, and then they run into this pattern of denials that you've drawn attention to.
Yeah. Yeah. I mean, there was no doubt in the minds of folks in ASAP program that Nikki needed intensive inpatient treatment. And even second time around, I stayed in touch with these folks. So when he finally relapsed, they were like, yeah, what you're telling me, he needs another round. And yet, proving that need is very hard. And for the first round of treatment, we actually did seek reimbursement. We got a $75 check. I wish I could find it. I thought I had scanned it and I hadn't. For over $150,000 worth of treatment. We had to remortgage our house and everything to get that done. But we did, and we were so glad we did. And we were told that they thought what he needed was outpatient care. And this was Blue Cross Blue Shield of Kansas, which we've always been covered by. And, so it was like, nope, and I didn't have the wherewithal 10 years ago to try to fight that. This time I was just determined to make them pay. Yeah.
So I think it's interesting to me that they made a determination that what was right for him was outpatient care, so they weren't going to pay. They meaning whoever there was reviewing the medical records and the utilization. And I'm just really wondering how many times people have run into that situation as well.
Yeah. 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 Well, and I thought it was very painful to have the ASAM guidelines used against me, because clearly when you look at those guidelines, he met criteria for intensive inpatient treatment. And I really resented that. This last time, the more denials I got, I was like, that's not true. I'm fighting till the bitter end, but I think that unless someone's able to find either get educated themselves or find somebody who can help them sort through all this stuff, this hand waving and using all these guidelines as an excuse to deny care, it works because people go, oh, okay, I didn't know that, but in fact, he totally, met criteria for intensive inpatient care. And so I think that's why some coaching and technical assistance would help the families who, have the wherewithal to start down this road.
I do have a question for you.
Oh.
We've got an APRN student who's joined us, primary care provider. Are there any tips on documentation and coding to help families get coverage? What's good to say? What's not good to say?
I am not an expert in this area. I think, so I run a tobacco treatment service for the University of Kansas Hospital. So, we have had to learn how to document and what's considered sufficient documentation and sufficient care, right? Evidence-based care that meets criteria for reimbursement. And so when you look around on the internet, you can see all kinds of organizations that provide, that provide advice to medical care organizations on coding. There's coding boot camp and blah, 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 blah. But I just wonder if that exists for mental health providers with, whether there is that kind of assistance out there to tell people, this is the kind, not coaching them to get money when they don't provide the service, but what kind of service meets the guidelines, and then how to document that service so that the patient gets the care they need, and then the reimbursement happens. And this is the promise of coding, I think, and of our system, is that there are standards, and then people need to meet those standards in order to get reimbursed. They need to provide evidence-based care and guidelines-based care, but then they should get reimbursed for it. So I don't, and maybe you guys know, or other people on the call know, where providers can go for that kind of guidance on how to document properly.
And I
I'm
think
sorry, I don't.
that varies according to the provider type for sure. But
Right.
I think that you've really hit the nail on the head here, because when it comes to the primary care space, this is often the front line where folks are going to encounter people who have needs. And that's not going to be a topic that is covered extensively at their third party billing folks seminars. I think that documentation that you're talking about is incredibly important, but I'm hopeful that the entrance of the United States Department of Labor, the entrance in Health and Human Services, and the increased activity and scrutiny of our own Kansas Insurance Department is going to help in standardizing the reviews and the acceptable reviews and criteria that insurers are placing on these authorizations. And, in some ways, not having a prior authorization on a behavioral health service puts that provider at a bit of disadvantage, because that prior authorization sets out, okay, these are the hurdles. And if you don't see the hurdles until at the end of the providing the treatment, that can create a little bit of a problem. But for families, I mean, you talk about the burden of needing to get access to all of the medical records. You then are having to make sure that the documentation of all of the communications between the provider and the insurer, that you have all of that information so that you can provide it. And then, of course, the cost and burden of securing an attorney to represent your interests. I mean, for me, having been involved with the Kansas Mental Health Coalition for a couple of decades, the increased scrutiny that we are seeing from federal regulators and from our own state insurance commission is a positive step towards standardizing these expectations and perhaps putting families in a better position to advocate for themselves. But the gap right now is still pretty extreme. When you share your success story, how much effort go into that?
Yeah.
It's alarming. I would also like to point out that you mentioned that when the provider gets paid up front, their own incentives to fight on your behalf are decreased. It's not that they don't care, but the extraordinary amount of time that goes into billing and record keeping and communication with third-party payers, it's a huge administrative cost to any kind of a provider. So obviously their own incentives are, they're going to be a lot higher if they're pursuing their own payment as opposed to the family's reimbursement. Do we have any other questions from our participants today?
Does not look like we have additional questions. Do you have any additional thoughts anyone would like to share?
I would like to, Kim, if you would like to sort of wrap up your comments and what, kind of what you want people to learn from your experience. We do have some information from the United States Department of Labor and the Kansas Insurance Commission office on how families can reach out for complaints or to challenge insurance denials for behavioral health coverage. And I will show those after your closing comments.
Yeah, I do want to point out that, the lawyer that we secured knew nothing about this. And I couldn't find a lawyer who had expertise in this area. I tried a couple different law firms in Kansas City, just sort of asking around. I didn't want to get roped into a lot of money for nothing. And the lawyer I ended up working with, basically, I wrote the demand letter. He put a few legal terms in it and sent it off. I did all the legwork, but it was good to have a lawyer, on the letterhead, because I think that it got the attention of probably the insurance department as well as Blue Cross Blue Shield. So we need people with legal expertise in this area and a passion to work in this area as well. And so that was, hard. But it was totally worth it. He's doing well now, again. And so, we just treated it as if, he had a cancer diagnosis, which, it's as serious and life-threatening. And but, and I feel lucky, but also guilty that, our family could afford to do this without losing everything. And other families shouldn't have to make that choice. So, those of you who are out there, just, keep up the good work and let's hang together and make this happen.
I will
Right.
share this. I can, just to share with folks that the issue of accessing coverage under folks' insurance is gaining a lot of attention nationwide. It's not just an issue in Kansas. What makes these problems for families more complicated is that depending on the kind of insurance policy that you have, it is regulated by different oversight entities. And for instance, if you have company insurance from a large employer, it is likely regulated by the United States Department of Labor. And this slide shows the 1-800 number that you can use to speak to an expert at the Department of Labor. They call them benefits advisors, but this helpline has been set up to, number one, actually have live people answering it. Number two, to get your call to someone who is regionally based, so that hopefully you're speaking to someone from the Midwest region that is governed by the Department of Labor, and then they can help you to see what steps you need to take moving forward to get your questions addressed. This is particularly for folks who have policies that they're trying to access either for themselves or for a family member coverage for medically required, mental health or substance use disorder benefits. Additionally, in the state of Kansas, Kansas health insurance plans are regulated by our own Kansas Insurance Department. This is the website that you can go to get assistance from our Consumer Assistance Division, and they can help you to file a consumer complaint if you are having trouble accessing the coverage that you're entitled to under your plan. Now, it is absolutely true that there are all sorts of complexities that enter into these questions. As Kim pointed out, they were using a provider that was out of network. But that plan had out-of-network benefits that they were entitled to. So sometimes when folks talk to their insurer, they will get an answer like that makes it sound like there's nothing to be done. But we highly recommend that folks get assistance from the Kansas Insurance Department or from the United States Department of Labor, or both. These two entities do talk to one another, and try to pursue some solutions for yourself, because unfortunately in the area of mental health parity, one thing that we see is that the squeaky wheel does get the attention. And it does seem that there are so many processes in place that make it difficult for the average citizen to access coverage that they are absolutely entitled to under state and federal law. The Kansas Mental Health Coalition is a roundtable organization, and we participate in advocacy activities. This particular committee has been established to try to move forward reform in the area of mental health parity and in assisting people to access the coverage that they need. And so if you would like to reach out to us on questions relating to mental health parity or other mental health policy issues, please feel free to do so. The phone number that is here is my phone number. And I will tell you that I am at the Capitol most of the time this time of year, but I will return your call if you reach out to me. Audrey?
All right. Terrific. Just one little reminder that came in the comments, questions, and answers is that making a complaint to the Kansas Insurance Department is very important, because they do have then documentation that something is not going well, so that they can pursue it. And this is on any insurance issue, but specifically on behavioral health parity issues as well. So I think with that, we've answered all the questions. Kim, thank you so much for sharing your story. Please tell your son thank you as well. It's always important to see how things are working out there in the real world instead of on the theoretical side, which is a lot of the conversation that goes on when we're policy making. Thank you all for joining us for our 5th Parity webinar, and we hope to see you again. Thank you.